It is important that you are able to obtain accurate and objective data from your patient. This is especially important in pediatrics, where children can subtly compensate until they no longer can and things go south fast. Before you rush in and obtain vital signs and perform an assessment on your pediatric patient, let's first talk about some of the ways that the approach to a pediatric assessment differs from that of an adult's. Hi, I'm Anna, and I'm a critical care registered nurse who has a lot of experience taking care of really sick kids. In this video, we are going to talk about your visual assessment versus your hands-on assessment and why both of these are so important in kids. I'll also give you some of my best pro tips at the end so that you are better able to obtain accurate assessment data from the pediatric patients that you care for. I've provided timestamps for you below in the description so that you can jump around and quickly find the information that you need. The general approach to the pediatric assessment is twofold. It's a combination of both your visual assessment and your hands-on assessment, and both are equally important. A visual assessment is especially important in pediatrics, one of the reasons being because their behavior can change around strangers, especially if they think those strangers are going to poke and prod at them. And it's necessary to assess how your patient looks at rest, because this can vary greatly from how your patient looks when they're awake and potentially even agitated. Our visual assessment consists of the observations that we make before we even enter the patient's room or as soon as we enter the patient's room. This can be done by looking through glass walls and windows if your patient is in an ICU room, or by making observations from the door before your patient realizes that you've entered the room. Observe your patient's behavior with their parents and see if it's appropriate for their age and developmental level. Finally, you will then tailor your visual assessment to your patient's specific admitting diagnosis. For example, if your patient was admitted for respiratory distress, you would assess their breathing while they are relaxed and comfortable before a stranger comes in. After you have performed a quick visual assessment, you will then transition to your hands-on assessment. In adults, this would be your head-to-toe assessment, but in kids, it's a little bit trickier and you have to be a little more sneaky. Now, this will vary from patient to patient, but typically you will work from least to most invasive. For example, if the child is calm initially, you may go ahead and obtain your blood pressure or auscultate heart and lung sounds. Or if your patient is upset from the get-go, you may leave on your blood pressure cuff and come back and obtain a reading later when your patient is asleep. Approaching an assessment in this way takes a lot of practice, but it is very important to start thinking about these types of considerations when you are obtaining vital signs. This type of approach ensures that the objective data you have just obtained, your vital signs, is as accurate as possible. Now that we've set the stage for success, let's talk about 3 tips I have found incredibly helpful over the years when approaching the pediatric assessment. Tip number 1 is to use the parents. Parents are familiar, comforting, and likely have a level of authority established with the child too. If at all possible, allow the child to sit on the parent's lap. I also like to have the parents help as much as is safely possible, such as holding an arm still when obtaining a blood pressure. I will also sometimes have the parents give the child instructions for me, like sit on the bed or sit still. Next, it helps to keep things familiar. I have the parents present whenever possible. Having a favorite stuffed animal or blanket close can also help keep the environment familiar and similar to what it could be like at home. And in the age of tablets and cell phones, I will have the parents pull up their favorite TV show or movie to provide distractions and further help keep things familiar. Finally, my last pro tip for providing care to children is to get on their level. You are a giant and a stranger to little kids. It's important to make yourself less imposing if at all possible. You can get on a child's level by kneeling down on the floor or by raising their bed a little bit higher and closer to eye level. Just remember that if you raise the bed, don't forget to lower it again before you leave the bedside. And if you're talking to the child, try to get on their level and don't literally talk down to them. Kids are so much more likely to listen and pay attention if you are able to maintain eye contact with them. And as a final disclaimer, While I have used all of these tips many, many times before, these tips should never be placed ahead of providing quick and safe care to your pediatric patients. I hope that you have found this video helpful and that you are now a little bit more comfortable with approaching the pediatric assessment. You know the importance of obtaining both a visual and a hands-on assessment, and you have some tips to help you work with children like you are a veteran peds nurse. In the next video, we will talk about obtaining vital signs in pediatric populations, which is the very next step that follows your visual assessment. But if there are any other questions that you have about pediatric care, please comment and let me know.